recommend in your work to try to implement more and more tuber-to-git implants. Means statistics, my statistics shows that these are really most successful implants. The rest, you see, nearly the failure rate is nearly the same in the other anatomical positions. The other position where the failure rate is less. This is interforaminal area, also very stable area. So we have failures by construction type. You cannot see very well over there, but these are failures by the means. This blue thing is the full upper and lower jaw rehabilitation. So you see the failure rate is very low. Here we have a full upper only. We have a full lower only. And these are segments. As you can see from also from these statistics that in the segments the failure rate is relatively higher than in full jaw rehabilitations. This also comes to confirm that some of us who are beginners, according to this, is better to go for full jaw rehabilitation first, because it's much easier to do, and because of this, the failure rate is less. So if we want to go for segments, we have to postpone a bit, so to get a little bit more experience, and then to go for segments. The reasons for why segments are not so not so easy to do segments, they're obvious. First, cross-arch stabilization is missing. Secondly, the corticals are not so available. We have quite a less amount of corticals available in segments, so we have to be very, very precise. And there are other influencing factors like natural teeth, like occlusion. So the recommendation is, and the statistics proves this, that first it's good to go for full jaw rehabilitations. Okay, this is something interesting. This is how many implants are placed in healed sites and how many implants are placed in extraction sockets. 52% of this more than 2,500 implants are placed. It's nearly half-half, as you can see. It means these are placed into healed extraction, in healed bone. These implants are placed into the extraction sockets. And what is interesting, we can see the failures in fresh extraction socket versus healed site. These are failures in extraction socket. These are failures in the healed site. You see failures are 30% in extraction sockets and 70% in healed sites. Actually, this statistics is consistent with the statistic, I think, Professor Scortecci. I think he did this 10 years ago with BOI implants, and he has same conclusion. In that statistics, Professor Scortecci, he included 5,000 implants, BOI, means not BOI, but disc implants. And his statistics also shown that the implant success in extraction socket is a little bit higher than success into the healed sites. So this means that that proves that the immediate implantation, immediate loading protocols, they are really highly successful. About diabetes, as I said, the failure rate is very low, so we cannot draw conclusions. But in this study, in my practice, 3% of the patients were diabetic. 5% there were no data for this, and the rest weren't diabetic. What means diabetic means this patient has a clinical means they have diagnosed diabetes. There's a lot of patients who knows that they have a high sugar level in the blood, but they are not diagnosed as a diabetic, so that's why we don't put them there as diabetics.